The topic of this video is temporomandibular disorder and tinnitus. So you must have heard a lot of people say that tinnitus can be because of temporomandibular disorders, and you can treat tinnitus by treating temporomandibular disorders. Did you ever understand the connection between temporomandibular disorders and tinnitus? For you to think logically whether we can treat it or not, if you don't understand this in depth, then this video is for you. Okay, so whether or not we can treat tinnitus is a subject of controversy, and I would say a subject of chance. Okay, so let's first understand logically the connection between the temporomandibular joint and the tinnitus. Okay, so what is tinnitus? Tinnitus is a continuous ringing, buzzing, or humming or throbbing sound that the patient feels that he hears inside his ear. It is sometimes accompanied with a hearing loss, and sometimes the patient has no perceptible hearing loss. So tinnitus actually is the patient hearing his own body sounds. So what happens is the patient, due to XYZ reasons, loses hearing capacity either entirely, or he loses the hearing capacity in certain bandwidth in the audible range. Okay, so sometimes he can hear the normal frequency of speaking, but he cannot hear the music through headphones, or he cannot hear very loud music. Okay, so you can have a complete hearing loss, or you can have hearing loss in a particular spectrum also. So that is why the patient can have tinnitus with hearing loss or without hearing loss, because he might not realize that he actually has a hearing loss. Okay, so when the patient loses the capacity to hear in a certain bandwidth or the entire bandwidth, he starts hearing the internal sounds of his own body. The sound of the blood rushing through blood vessels, the sound of us breathing, the sound of the arteries that are lying behind the ear. So when they throb, it gives a throbbing tinnitus. The buzzing, ringing or humming sound is because of the blood flowing through the blood vessels. So a patient hearing the internal body sounds is actually tinnitus, and that happens usually due to a loss of hearing capacity for external sounds. Okay. So once you understand what is tinnitus, now let's talk about what relation it has to the temporomandibular joint. So literature says that there is a physical connection between the middle ear and the temporomandibular joint. So see, our temporomandibular joint lies here and the disc is here. So the disc is connected to the malleus, which is a bone in the middle ear. If the malleus is connected to pinto ligament and to the disc in certain percentage of the population, and if this disc gets displaced or dislocated, it pulls the ligament with it anteriorly. And when this ligament is pulled anteriorly, the malleus is pulled along with it, which causes a hearing loss. And when there is hearing loss, the patient can hear the voice inside his body, and that is what is called as tinnitus. So going about this, in certain percentage of patients, correcting the disc displacements and disc dislocation disorders might benefit the patients in their tinnitus. So if a repositioning appliance improves the signs of tinnitus, then maybe repositioning the disc surgically or maybe removing the disc entirely may resolve his or her tinnitus. Okay, so the treatment of tinnitus in disc derangement disorders cannot be promised, but you can try to reposition the disc and place it as close to centric relation as possible and see if the tinnitus improves. So improvement in tinnitus can be a bystander advantage in treatment of temporomandibular disorders going by this connection. Okay. Now, there is a foramen of Huschke, which is a communication between the middle ear and the articular fossa. It's an actual communication. It's a foramen between the fossa and the middle ear. It remains open till the patient is 5 years old and then closes on its own. In certain percentage of patients, what happens is this foramen is not closed. And if the patient has an inflammation in the temporomandibular joint like retrodiscitis or a trauma that pushes the retrodiscal tissue inside this foramen, it leads to inflammation in the middle ear and hearing loss in the middle ear, and that is why the tinnitus develops. In these patients, resolution of retrodiscitis, resolution of inflammation in the temporomandibular joint might benefit their tinnitus. Okay, so again, you can't promise to treat tinnitus, but it can be a secondary advantage to the patient if the cause was a retrodiscal inflammation in such patients. Okay. The third mechanism that people explain is the trigeminal nerve supply system. So you already know that there are a number of sensory nerves that are converging to our brain. And when there is a continuous painful impulse transmission, there is central sensitization. And the interneurons that are running from different areas can communicate with each other and confuse the information and transmit it to cortex. So you see that the auriculotemporal branch of the trigeminal nerve innervates part of tympanic membrane. The trigeminal nerve also innervates the eustachian tube, the tensor villi palatini, endolymphatic sac, tympanic plexus, and etc. and etc. So when there is continuous pain impulse transmission from the trigeminal nerve system to the brain, there can be a disturbance in the nerve conduction, and this disturbance in nerve conduction of trigeminal nerve can lead to perception of tinnitus in patients. In such patients, maybe resolution of pain in the temporomandibular joint may lead to relief in tinnitus symptoms. Okay. The cochlea is in a part of the middle ear that converts sound waves to electrical impulse, and these are transmitted to the brain that converts it into sound again. So a spreading infection from the temporomandibular joint can damage the tiny hairs in the cochlea and then lead to a loss of hearing and result in tinnitus. So in such cases, when the infection in the temporomandibular joint is resolved, the tinnitus may resolve. So you know now that there are 4 mechanisms of connection between the temporomandibular joint and the middle ear. So it can be a physical communication like foramina fuscae or a pinto ligament, or it can be a disturbance in the nerve transmission, the pain pathway that leads to confusion of pain with tinnitus, or an infection and inflammation of the temporomandibular joint that can disturb the hair cells of cochlea and cause tinnitus. So in these patients, you might have advantage of treating tinnitus. So we tell the patients that we actually are treating temporomandibular disorders. If there is a relief in tinnitus, it can be a byproduct of temporomandibular disorder treatment and cannot be assured. So treating tinnitus per se is not possible for a dentist, but if the patient is suffering from an active temporomandibular joint disorder, then the treatment of active temporomandibular joint disorder can have a treatment relief in tinnitus as a byproduct. Okay.